Good afternoon and welcome to Zeifmans' third webinar since COVID began in March. This seminar is entitled When September Ends. When September Ends is a song by Green Day, and it has always reminded me of summer is over and fall is coming and the business cycle starts again. And so given everything that we've gone through in the last 6 months, hopefully the information that Armand and Peter are going to bestow upon us today means that it's going to be a great fall and that Christmas is going to come early. I think today is going to be a great session. It's the first joint session that we've actually conducted with clients of ours, Burton, who are one of Canada's largest investment banking firm in the biopharma and healthcare space in Canada. And so it is with great pleasure that I introduce Armand Balboni, who is a friend, a colleague, a client. He is the CEO of Apili. He is on the board of directors of Burton, a senior advisor. An interesting note about Armand is that he is a U.S. citizen and has done extensive service in the U.S. military with respect to infectious disease. So without any more ado, I will let Armand begin talking about how we are going to find a vaccine by Christmas time. Armand, thank you for participating today.
Well, thank you for making this happen. I think it's obviously it's topical and front of mind for everybody. And so I'm hoping we can talk about vaccines and where we are, and it is confusing with the news cycle. So if folks have questions, I certainly look forward to that. Vaccines are a piece of what's happening right now, and I think in order to understand how the vaccines might be helpful, it's also helpful to understand what COVID-19 really is. And what I like to think about is that it's really a three-part disease. You have the initial viral infection. You have a dysfunctional immune system or an inflammatory response. And then you have a post-inflammatory response problem where organs then start to shut down because of an overactive immune system. And really, then the disease should be treated three different ways. Of course, the best way to deal with this is to not get it at all. And that's really what the vaccine aims to do. But we'll see how that works. So as a three-part disease, then you have viral infection where the cells all become infected. This is the time when the virus replicates inside the cells and mostly in cells in your lungs, but really everywhere else in the body as well. And if you can stop or shut down the disease there, you're in good shape. And so convalescent plasma and antibodies and small molecule drugs that also is the way to stop things like Tamiflu-like approaches. Let's stop the disease before it gets going. By the time you get really infected and start showing symptoms, your immune system, I'm actually seeing participant feedback with folks that can't hear anything. Is that, I wonder if that's going on for a lot of people. But I'll keep talking, and then if folks can hear, if they can't, then we'll see. The next phase is really an inflammatory phase that where your immune system has become dysfunctional, and you over-respond, if you will, to the disease, and that's the cytokine storm that everybody hears about. And so drugs that can shut that down are things like steroids or dexamethasone. That we heard about. The problem, of course, with those drugs is that they are, in fact, pro-viral and pro-infectious. They shut down the immune system. And so you run the risk of course, acquiring other types of illnesses like fungal infections or bacterial infections. And at this time, most people are actually on ventilators and go to hospital. And then, of course, there's all the post-ventilator problems that happen after that. And so that's the third phase of the disease. So I guess the bright spot in all of this is that we're starting to understand what COVID-19 is. And we're starting to be able to tailor the the treatments to be able to deal with those three distinct phases. And right now we're spending a lot of time talking about vaccines, and that certainly is a bright spot. That bright spot is we're moving very quickly towards something that could work. But where then do these vaccines and therapeutics fit in? And vaccines, of course, prevent you from ever getting sick. They're hard to develop. Viruses are really good at getting around them, and they don't always generate the response you want. But it's part of the toolbox. The toolbox then is vaccine, early stage therapeutics like small molecule drugs that you can give to an outpatient setting, like what we're working on at Apili Therapeutics. And then you move into the other kinds of drugs that are out there, like the remdesivir, which is a drug that also knocks down the virus. But I think as we go through this outbreak in time, we're learning more, we're developing more tools, and I actually predict that this is going to be a multimodal disease, like many infectious diseases, where we have to build the toolbox of all available treatments. It's not going to be any one thing that works. And in many cases, the first generation of vaccines don't work very well either. And we're already starting to see that people are setting the stage. Anthony Fauci and Bill Gates and a number of different companies like Moderna and Pfizer are setting the stage for a vaccine that may only be 40 or 50% effective. But that may be good enough to start. And I think there's room for lots of other follow-on vaccines like we have in a number of other indications. So I think it's going to take time. I think it's going to be multimodal. And I think finally, there'll be a number of distinct regulatory pathways that are available to get things out more quickly. We saw it with remdesivir. And those are emergency use authorizations, or in Canada, conditional approvals that allow for the use of drugs that show a benefit. And I think that can go out to people earlier. I predict that you'll start to see some EUAs for other programs in the next few weeks. And we may even see a conditional approval or an EUA for a vaccine. I'm not sure, it hasn't been too politicized already, but I think that's certainly out there. So I guess I'm always a half glass full kind of person, despite a pandemic, and think that we're starting to see the toolbox being developed that's going to help us, and we have the regulatory tools in order to introduce some of these potential solutions to folks moving forward. So that's a bit of the overview. Certainly, I'm sure there'll be more questions going forward.
I will ask the first question. And in doing research and looking at who is more susceptible to the disease, and I looked at males and females. And one of the things that my research told me is that the virus attaches to the X chromosome, and males have one X chromosome and females have two X chromosomes, and therefore their immune system is better equipped to fight the virus. Is that correct?
I think that the concept there is correct. I don't know that I agree with the specifics, but so conceptually, it's very, very clear from the data that there are differences in responses to viral infections, and women's immune systems tend to be a little bit better at clearing them. And some people think that it's an evolutionary advantage to keep women who may be pregnant from the fetuses from getting infected. Because what I will say is that older women outside of childbearing age and men, you start to see less of that effect, that gender effect. I believe the best reason for that I've seen so far has less to do with the chromosome and the clear differences between males and females, but there is a higher expression of a protein called ACE2, which is what the virus uses to gain entry into cells, and in particular in pulmonary or lung cells. There's higher expression in males than in females, and there may be some basis for that. So the infectivity or the ability to infect cells is greater in males than in females. And then I think there's also some data to suggest those with a body mass index of over 26, and some say even 30, have a much worse outcome with this infection than those with a lower BMI. And so again, I think it has to do with the expression of proteins that are necessary for the virus to gain entry into cells.
I have a quick question. Jason, I've got Peter Andersen here. I've got a question for Armand. Armand, can you hear me?
I can, yep.
Tell me about October 22nd. Is this going to be an important day, this open session forum on the development and authorization of vaccines? It's the CBER, the Center for Biologics Evaluation and Research. Is this something that you're focused on? Is this a calendar item for you?
It is. I think that this is one of those moments where well, let's outline. Let's talk about the problem first. I mean, if the vaccine is being produced and probably fielded very, very quickly, and this presents all kinds of problems scientifically. But I think more importantly, it presents problems from a public health perspective, given the echo chamber that's out there in the 24-hour news cycle. I'm actually less concerned that they'll find a vaccine that shows some effect than I am afraid of people who are fearful of getting a vaccine. And so the more we can do, and this date is actually quite important, to start to get all the players talking about how we're going to choose, field, and encourage folks to get a vaccine. What are the most promising vaccines out there? What do the data look like? The more open discussions that we have about the process and the product, the easier it's going to be for those frontline folks in public health and in clinics to get people to actually take the vaccine. We could have the best vaccine in the world, and if folks don't take it, we're doing it for nothing. So I think that's a very, very important day, just to get a feel for where are we, what's the scientific and medical community feeling about the prospects of a vaccine earlier, and starting to get an azimuth check on when we might actually have something fielded.
October 22nd. Thank you very much.
Yeah, and as follow-up, I have to say this is a bit of a soapbox issue for me and for others. I think we've done a terrible disservice by politicizing a vaccine. It's hard enough to get folks to want to go in and get the annual flu shots, and by creating an environment like this, particularly in the U.S., less so in Canada. I think Canadians will do what they do in crises, is that everyone kind of gets their act together and this gets rolled out, which is why you're seeing many fewer deaths in Canada. So I think it's less of a problem. But of course, we know that viral illnesses don't respect geographical boundaries, and so I think the politicization of this vaccine potentially in the U.S. is really bad for the world.
A Canadian question. Canada's role in the development of a vaccine, what seat at the table do we have?
So there are a number of companies that that are working on vaccines, including Medicago and IMV and Abcelera as well, furthest along probably. I think Canada once again, and you'll hear from the tone of what I'm saying. I've been very proudly coming to Canada since 2004 when I was first working there, and right before we started Burton. So I've come to see a lot of the response in Canada. The absolutely terrific science that comes out of Canada is on par with anything in the world. Where I think Canada is falling down a little bit is the level of manufacturing of vaccine within Canadian borders, which right now is very, very low, if any, which means that we're going to end up waiting in line to get vaccine to be able to distribute to citizens. So I think PHAC and the government and the procurement folks are trying really hard to solve this problem. They're working very hard at it, but it's a hard thing to just start up. And so I think Canada certainly has a seat at the table, but you'd have a much more prominent position if there was more manufacturing going on of product, because then other countries would have to come to you. And you have the imprimatur of being a really scientifically advanced and regulatorily advanced country. And so I think Canada's in a perfect position to help supplement some of the other manufacturing deficiencies that we see in North America in particular. And I just don't think they've done a good enough job taking advantage of it before the pandemic.
A final question, and there are 3 or 4 from the guests, is I've watched various clients go through phase 1, phase 2, and if they get to phase 3, all of the time, the energy and the money that it takes to get there. And then I've watched over the last 6 or 8 months the speed with which people have endeavored to find a vaccine, and how quickly we seem to be able to say, okay, we can have a phase 3 clinical trial. And are all of the same rules and regulations and security checks and all of those things going to be in place, or is there going to be this rush to find a vaccine that you indicated may be 50% effective without actually knowing what the negatives of that vaccine are going to be?
Mm-hmm. Yeah, that's a great question, and I'll try and have a balanced response, because what I think the short answer is we just don't know. We don't know what we don't know. And anytime you're trying to give a vaccine to a population to prevent a disease, your risk-reward balance is very skewed, right? It's all risk until you know that it works. And so that's a tough place for regulators to be. And if you ask regulators to then go fast, you necessarily can't take the time to put the vaccine into the millions, tens of millions, hundreds of millions of people that eventually it's going to go into. And so if you think about this, we need to probably vaccinate, I don't know, I've seen 70% or 60% of the population in order to generate some sort of herd immunity. And I use that term very lightly. It's a very loaded term these days, but to generate population protection, let's put it that way. And so the question is, this is tens of millions of people in Canada, billions of people worldwide. Even if you have an effect rate, negative effects in less than 1% of the population, that's still thousands or tens of thousands of people. And so we just don't know what that's going to look like. I like to believe that the regulators are not bowing to political pressure, but I think it's a tough situation. I think it does show me, though, again, just to be kind of glass half full, that there's no reason for other drugs, if we can move this fast for a vaccine, which again is highly risky, given the fact that you're not sure what that risk-reward balance is going to be. For drugs that have a very clear benefit for the population, there's no reason that we need to take this long to develop drugs going forward. I think this kind of flips the regulatory model on its head a little bit.
Okay, thanks. Let's use the U.S. as an example, given the size. Let's assume that in January there's a vaccine that's approved. How effective and efficient is the rollout in delivering that vaccine to the American population going to be?
Mm-hmm. Yeah, that's a great question. I think, again, I alluded to this before. I'm less concerned about the science behind the effectiveness of the vaccine. You can debate the risk. We'll find out what that is. There's always some risk with any drug. But I think there are tried and true vaccines that we're moving very quickly with as part of this therapeutic option. And so I think I'm less concerned about the science. The medicine will, obviously we'll learn more as we go. The logistics really frighten me a little bit. This is not a small undertaking. I think, the ability to get vaccine out, well, first of all, just to be able to produce the number of doses that we think we need. This gets back to this idea of manufacturing. I don't think that there certainly is not going to be enough vaccine available to vaccinate everyone in the world. And the world, let's be fair, is naive to this for the most part. And so you need to vaccinate large numbers of people. I think it's going to be a real challenge for the U.S. I think that, it is not something that I have a whole lot of faith in terms of what I saw from the attempt of the federal government to roll out PPE, personal protective equipment. They did just a terrible job. It does not seem to be a very coordinated effort, to say the least. And so they're throwing a lot of money at it. But the logistics are no joke, really hard to do. And so I think what I have seen is some sectors of the public health machinery start to say we give it to the most vulnerable, the highest risk first. But I've yet to see a list on as to what that looks like. And that's really where you need a top-down approach. We need the plan to come from the federal government, and then the states all fall into line so that we can effectively distribute. Now, we do have a military, having spent over 18 years in the U.S. military, we do have a group of folks that do this for a living in terms of logistics. Again, I think they're not leveraging that kind of expertise enough to for example, to build what are called points of delivery or pods. You can deploy National Guard and Reserve troops in different jurisdictions. They have control of movement of product, and you can then provide an orderly rollout. We've seen nothing like that so far. So I don't think we're going to see coverage in many parts of the population until late 2021. So I do see some feedback questions if you want me to try and address some of those as well.
Okay, I will ask this one more question, and then you can.
Sure.
From a different strains of the virus, and is there going to be need for various vaccines, and will there be the opportunity to have an annual coronavirus flu shot?
Yeah. That's a terrific question. I think all of the evidence right now from so there are other strains of coronavirus besides COVID-19. The other strains of coronavirus cause colds that we get usually in the winter in the northern hemisphere and the southern hemisphere winter as well when people are indoors. I think it's looking an awful lot like COVID-19 is looking like a lot of other coronaviruses, that the immune response will wane within 4 to 6 months, meaning that this is going to go from a pandemic to sporadic outbreaks. And from what I've seen from some very, very smart scientists is that this will likely then circulate in the world as just one of the coronaviruses that are the cold. Now, not any better. So I believe that what we're going to see, given that the antibody response, neutralizing antibody response in some of the viruses, is that we will be seeing an annual or at the very least a booster, a fairly frequent booster for COVID-19.
Right. Did you see any questions or any feedback that I may have missed from a question perspective, Armand?
No, I mean I think these are all great questions. I guess the one thing that I would say is in all of this, I know I love the questions that are. I think we need to try and maintain a positive outbreak as much a positive perspective as much as we can during an outbreak. I think that industry has really stepped up its game, and the public-private partnerships that are developing are starting to mature. It's hard to think sometimes that we're only about 6 or 8 months into this. It was only in January or February, and some would say even March, that things kind of took off. And while I think the Canadian government was slow to get organized in terms of outreach to the private sector, they're really starting to get their legs under them now, and the same in the U.S. And so it's not a payer problem on this one. This is really, can we find the right toolbox? And I emphasize that it's a mix. You've got to have lots of tools available to make this happen. So can we find the right mix of tools so that we can respond to this and turn it into smaller and smaller chunks that are more tractable. In other words, it's not a pandemic anymore. It turns into regional hotspots. And then from regional hotspots, maybe you have local community with an outbreak, but you can address that. You can test and trace, give them drugs, and then start to vaccinate, wait for the vaccination to kick in. So it's a process, and I think that we're starting to kind of get our legs under us a little bit. So that leaves me very hopeful that we can find a solution.
And so I have one last question. Given that you've spent time up in Canada for the last 15 years and your work in the U.S. military, how would you compare our public healthcare system and the U.S.'s private healthcare system and the ability to deliver the solution? And will it have an impact?
I think it will, and I'll use. So I just received my annual flu shot, and here, this is my moment. If you haven't gotten your flu shot yet, please go and get it. You don't want to be struggling with trying to figure out if you have COVID-19 or the flu. I was getting my flu shot, and I have a very, very good insurance plan in the U.S. Mostly because of my involvement with the military. I don't worry about all that much. It's much like the Canadian system. You just have your card and you go. And I still had difficulty finding a place to get my flu shot. They had to check to see if my insurance was good. That took time. And so suffice to say, it was not the smoothest operation. Anytime I've had any contact in Canada with the healthcare system, I had my social insurance number. I had paid taxes. It was just some people may complain about the wait, but from a public health perspective, the system is primed and ready to go. And so I think from an operational standpoint, Canada's in much better shape than the U.S. I think where Canada suffers, and the U.S. is probably ahead, is the ability of the Health and Human Services (HHS) in the U.S. to buy and stockpile product, using the bully pulpit and leverage of the federal government to be able to identify, develop, and procure product for a stockpile is something that Canada is just not as familiar with. And so I think that the U.S. is familiar with it because of medical countermeasures for biodefense and things like that, anthrax. Canada, of course, has PHAC, and it has the provincial government that work on healthcare. But there is a procurement piece that's trying to procure for PHAC, but then you also have provincial systems. It is really not that cohesive, and I think that's the one area where I think there could be some problems. I know Canada has entered into a number of different contracts for vaccine. I don't pretend to know how efficient that process was, but that seems to be the rate limiting factor right now is, can you identify, develop, and procure? I'm much more comfortable with the logistics and the rollout once it gets there in Canada. As a matter of fact, I think Canada will be in better shape for a whole host of reasons that have to do with on-the-ground logistics, and that has to do with the type of healthcare you have.
Okay, so I will ask one last question, and I'll do my best to ask it. Our participant has said, can we request COVID assessment centers to release the RT-PCR COVID-19 test results the same evening for international air travelers need this before urgent travel?
Yeah. Wow, that's a great question. So I traveled recently, and I had to have a COVID negative test within 72 hours of travel. So the answer is some centers are doing a better job than others, and I think the answer is we need to get these tests out more quickly. And so I think it argues for different technology. There are technological solutions other than I had 2 COVID tests, by the way. I had the nasopharyngeal, where they effectively scratch the bottom of your brain to get a sample at the back of your nasopharynx. It was one of the most uncomfortable tests I've had in a long time. And then I also had just the nasal swab, which is just the front of your nose, if you think of it that way. And both of them, by the way, have sensitivity and specificity, meaning that they're both almost equivalent when you get them. And the reason I say that is because one is more invasive than the other. And so I got the nasal front of the nose test within 3 hours. The nasopharyngeal test, for whatever reason, I had to get someone to deliver it, which means that it was harder to get. It took longer. I had to have them come out to my car and give me the test and then take it back inside. It was 3 days before I got the result. Now, there are also, by the way, saliva-based tests that have just come out that have demonstrated that they are both sensitive and specific, and almost the same as the other tests. And I would argue that all you need to do is spit in a tube and hand it to somebody, and you should be able to get it back. And so I think there's a technological piece of this. The tests are certainly getting better. And so I think, though, you can certainly try and get those tests back quicker and push on the government to do that. But I think that part of it is a technology issue. The more invasive tests, they just don't have the throughput. And so you can ask and ask and ask, and I just don't know that you're going to get them back any quicker. It's rate limiting based on the number of people that can take the sample. So tough problem, though.
Okay, well, Armand, thanks very much. I'm sure that everybody has really appreciated where we're at and where we're going to be, and a little bit more in layman's terms, so that when we all watch Fox or CNN tonight, we'll know how to interpret what they have to say. So thanks very much again for joining us.
Yeah, thanks so much.
Now I would like to introduce our good friend, Peter Andersen, live from Austin, who just returned from the beach in Galveston for his 3rd economic update. And hopefully Peter is going to have the best news we've had in the last 6 months. So I will turn it over to Peter.
Thanks, Jason, and thanks a lot, Jason, for the opportunity to come back and give you an update. What I want to do in the time that I have is to cover a couple of things. I have a basic message that I want to shout out to everyone. In other words, the economy, I think it can coexist with the virus. Okay, my basic message, I've got a few details under that. And this is different. It's not your mother or your father's recession. This is different from anything we've seen before. In other words, the textbooks aren't working. The economic models aren't working. Throw them out. What's happening is just not there in the economic behavior relationships on which economic models are built that we've seen over the last, how many years? The last 70 years. Big surprises. I always like to focus on surprises, Jason, because they kind of highlight what is crystallizing and what is taking place. Surprises are important, so I want to talk about that. The crisis, is it over? Jason, I talk to a lot of CEOs, and I do it because they're clients of mine, and they are basically all worried about Q4 and Q1. Okay, there's a huge worry about what's going on. So what comes next? And Armand, I really appreciated your comments because I guess what I'm saying is I'm kind of reading from the same playbook that you're talking about. I'm talking about the end game. What kind of an end game are we looking at in 2021? And I want to talk about that. And then I want to talk a little bit about risk management and the unexpected, things that are going to surprise us. Also, real estate. I always like to talk a little bit about real estate and the trends that are taking place there. So that's what I want to cover, Jason. let's go back to the basic message. What I'm saying is that I would be very surprised if there's a return to nationwide lockdowns. Okay, I just don't think that's possible, and I don't think it's going to happen. So to me, the economy has to learn how to coexist with the virus, and I think it is learning how to do that. Interest rates, near zero, looking at the central bank policy rates until into 2024. Until into 2024. That's basically what Jerome Powell told us yesterday in his press release and the press conference. Right, 2024, low interest rates. Mortgage rates, okay, below 2% for five-year mortgage rates, okay, in Canada. Below 2%. The TD and HSBC both have 5-year fixed mortgage rates below 2%. And the job market, well, this time around is so different. The jobless are concentrated in people earning under $50,000 and also in young people. So in a normal recession, the jobless problem is spread around to everybody. This time around, it's focused on people who are basically renters. They're not home buyers. And so that's one of the answers to why are we having this housing boom right now in terms of home sales and construction. This is different. The normal recession would last maybe 3 quarters, okay, 3 quarters, or 6 quarters if it's a bad one. This time, it was 2 months. Okay, it was 2 months. And we began to see the rebound taking place in May and June. And the speed and the scope and the strength of this rebound in both Canada and the United States, it really has beaten the consensus by a mile. So many economic indicators that we've seen in the last 2 months have been so much stronger than consensus guessing as to what we would see. And basically, retailing and housing, they're fully recovered. Consumer spending is not fully recovered because there's a service element in there. But retailing, which is basically non-services consumer spending, retailing has fully recovered to pre-virus levels in both Canada and the United States, and the same applies to home sales. So that is a big surprise, the speed, the scope, and the strength of this economic rebound on both sides of the border. And another surprise is the fact that virtual selling actually works. Virtual selling is great. People are able to sell houses using virtual platforms. New home sales in the United States in August, they're the highest since 2006. Highest since 2006. So we are really seeing kind of this virtual evolution really being successful in terms of business applications. Now, on the bad news, COVID has not subsided. There were so many assumptions back 2-3 months ago that by the time we got into the later summer months, we would see subsiding new cases. And what do I mean by subsiding? I'm not going to put a definition on that and be too precise. It wouldn't be honest to do that. But intuitively, you know what I mean when I say subsiding. We have not seen the virus subsiding in the United States. In Ontario, we are worried. We have seen more new cases than we've seen in a number of weeks in Ontario. Premier Ford is thinking about re-implementing stricter guidelines and protocols. So that has been a surprise and a disappointment. The crisis, is it over? I like to look at worldometers. And Jason, you know that that's one of my favorite go-to data sources for what's going on around the world with the virus. And I'm really, really worried about a second wave. I'm looking at France, and what I see really alarms me in France. Looking at new cases, the previous peak in the first wave in France was the 1st of April. The 7-day moving average of new cases came in at basically 4,500. It was 4,537 according to worldometers. 4,500 new cases per day. Okay, 7-day moving average on April the 1st. Right now, that number is almost 8,700. Looking at September the 16th, the 7-day moving average, 8684, almost 8,700 new cases per day in France. Basically double what we saw at the previous peak. So I really am worried about that because it's showing up in Spain as well. So I'm worried that this virus has the capability of jumping into this second wave, and that it's already happening in Europe. And what's happening in Europe, I'm afraid it's coming to us as well. Now, on the good news side, the death rate is surprisingly low. In France, they only had 33 deaths on a 7-day average basis, okay, as of September the 16th. Their peak on April the 1st was 954. So the new cases are coming back strongly. The mortality seems to be continuing to be quite low. That's the case in Germany as well. So I look upon those European countries as being leading indicators to what we can expect in North America. So I'm worried about the second wave. And then, as Armand mentioned, the anti-vaxxers. There was a Gallup poll that was released just a few weeks ago that showed that even if a vaccine had been approved by the FDA and it was being provided free of charge, 35% of the respondents would say no, they're not going to take it. 35% saying no. So to me, that's a surprise. But Armand, probably you know much more in terms of the history of epidemiology, and this happens over the decades with different kinds of vaccines. You have this vaccine reluctance, this vaccine hesitancy. But if 35% of the people aren't going to take it, and we have a second wave coming, well, then the efficacy is also a bad number. As I understand it, normal flu shots work 40 to 60% of the time. And, the number, Armand, that you mentioned was kind of in that range. So put the two numbers together, Jason. If 35% say no, they're not taking it, and then the ones that take it, there's only an efficacy of 50 to 60% maybe. Well, to me, that means that we have a complicated end game. We don't have a virus, a vaccine solution that is clear-cut. It's not like flipping a switch and all of a sudden we can go back to normal and we can get back to doing the things that we want to do. So I wrote down that comment. It might not be until late 2021 that we really see the combination of efficacy and vaccine acceptance begin to make a difference. So this is important for the economy because I think it means that the economy really doesn't open up and get back to working on full cylinders in 2021. And that's something that runs counter to what the Bay Street and Wall Street investing community are basically assuming now. I think that's one of the reasons that the stock market is doing as well as it is, because I think they're taking a simplistic solution as their preferred forecast. You know, the stock prices, looking at the Dow Jones Industrial Average today, it's just under 28,000. 27,800 basically. That's up 50% from where it was on March 23rd, up 50%. So I think that there's going to be disappointment in terms of how the economy performs in 2021. I don't think we'll see another recession. I don't think we're going to see nationwide lockdowns, but we won't be operating on all cylinders. So let's take immigration, for example. Immigration is important to housing markets, and I think the immigration turning off the tap, when that tap gets turned on again, it's going to really depend on the outcome of virus infections. And if we continue to have virus infections out there that cause concern and frighten people, it seems to me that we are not going to turn on the immigration tap anytime soon. Politicians will just be too worried about being accused of turning it on too quickly and making the COVID problem worse. So in terms of housing markets, and in terms of the Greater Toronto Area, which depends so much on immigration, 80%, of the population growth in Toronto is basically immigration related. So with the immigration tap turned off, where are we going to see the housing demand coming from as we move ahead into the spring selling season of next year? Well, I guess we have to think it's going to be coming from millennials and also from baby boomers. Millennials, and basically millennials are people that came of age in the year 2000. So they're now moving into their 40s or early 40s. They're coming into home ownership age, and they want to get out of rental. They want more space. It's time for them to get married, have families, have children. And that's, I think, going to be an important source of housing demand going ahead. The domestic population, the millennials, are key players here. They're moving into their home ownership years. The other part is kind of the forgotten part of housing demand. It's the boomers, The boomers, and they're now in their 60s and 70s. And I think that the boomers they're the ones that are wearing the masks, The boomers are the ones that feel vulnerable. They are very sensitive. They're very sensitive to the virus risk. And I think that their choices are going to change. They're no longer going to be looking at retirement homes as part of their playbook, as part of their plans for the future. I think that what they'll be doing is they'll be looking at ground-based bungalow-type homes outside of major density markets. And to a large extent, this could be vacation-related markets. It could be cottage country. One of the things that I've picked up recently is that cottage prices have not done what they normally do during recessions. Cottage prices have skyrocketed. I've heard big percentage numbers, double-digit % price increases in cottage prices. And by the way, try to buy yourself a boat. You might have to go onto the used market, but even there. So this is what I think the boomers are doing. I think that the boomers are interested also in moving, and there's no place like home, but they are wanting to get into more comfortable environments that are not high density and that are not high congregated density type markets. And we've heard this phrase, Zoom towns. A Zoom town. A Zoom town allows people to work from home. WFH, the WFH market. Well, it's working for people in the workforce, and many of those people also want to get out of rental, want to get out of elevator virus situations, they want to get out of high-rise, and they also want to get out into smaller centers. But when it comes to the boomers, they also love this new technology. They can have their book clubs online. They can do it with Zoom. Everybody can have fun, and they'll get used to it and adapt to it. And you know something, it's going to work very well in a smaller community. So that's where I think that the housing demand is going to come from. In terms of what I hear from the lenders, in terms of real estate, fashion retailing is really in trouble. We know that. And the lenders know that too. So the lenders are staying away from fashion retail type commercial development. But guess where one of the hot spots is? It's in industrial. Okay, industrial. The lenders can see positive signs for the future of industrial real estate. Okay, the industrial warehouse kind of buildings, all part and parcel of where the economy is headed as it gradually gets out of the woods in terms of getting away from the virus shock and moving into better times. Those better times, I think, are coming in 2022 and 2023, Jason. The better times in 2022, 2023, after we have acceptance of a package, of a toolbox of therapeutics and vaccines. 2022 and 2023 are going to be boom years because that's when the millennials really move into housing markets, and that's when the boomers, and they account for about 30% of consumer spending. That's when the boomers let it rip, and they have all kinds of backlogs of demand that resurface again. And the spending, I think, is going to be taking place not on trips to Europe or trips internationally. I think the spending is going to be taking place here at home base in Canada, in the United States, within the borders. So anyway, I wanted to mention that to you, and let me just check my notes. Okay, one more thing to mention. Low interest rates continuing until 2024, into 2024. Okay, low interest rates still low in 2024. But how about getting a loan? It seems to me that one of the risks that we have is debt and the international banking system. And this is kind of a spin-off effect from the economic shock that we have been experiencing. So I expect that we're going to see in the next 3 to 6 months lots of delinquencies, defaults, repossessions, foreclosures, failures, and bankruptcies. And what that means is that there are going to be credit and liquidity problems even though we have low interest rates. So in terms of individual business people, I think they're going to find that the terms and conditions and lending standards are going to be difficult to deal with, even if the interest rates stay low, which I think they will. So that's the problem. The loan covenants are going to be more difficult. It's going to be more difficult dealing with your banker to keep that line of credit the way you want it. And that's one of the issues that I see moving ahead. Anyway, I think I'll stop there, Jason. Don't want to take too much more time. Back to you.
Okay, Peter, thank you. And I have 3 or 4, I think, really good questions. And this morning when I woke up, I read an article about retail, bricks and mortar, and our good friends from Edmonton, the Gramisians, seem to have gotten themselves in a spot by opening up this new mall in New Jersey that may put the properties they have in Edmonton and Minnesota at risk.
Okay.
What are your thoughts on that?
Makes sense to me. I think that what's happening here is that the virus shock is causing an acceleration in trend lines. It's an acceleration in positive trends and an acceleration in negative trends. And when I look at, the list of retailers that have gone out of business, Men's Warehouse, Joseph Bank, Brooks Brothers, J. Crew, Lord & Taylor, Neiman Marcus, J.C. Penney, there's more to come. There's more to come. Now, the thing is that people are getting so used to buying online that it's so easy to do, and it's just accelerating this trend. I would say, though, that Amazon are putting up bricks and mortar stores. Interesting. So here they are. They're putting up bookstores, and they're putting up bricks and mortar stores for some of their other top-selling products as well. But anyway, I think that the commercial space as we know it, what are they going to do with it? How can it be repurposed? Repurposed to what? Community colleges? Something like that, perhaps? So it really is the death of retail, I think, the way we know it.
Okay, so I'm going to ask you that, okay, you're a fly in the wall right now, and you're going to give us 3 or 4 bullets that our good friend, Mr. Trudeau, is going to have in his throne speech and how they're going to affect our recovery.
Mm-hmm. Mm-hmm. Well, I don't know how versatile or how flexible Justin Trudeau is in terms of being a leader. What kind of infrastructure is he going to be talking about? Is he going to be talking about social infrastructure, or is he going to be talking about technological communications and hard asset infrastructure? You know, I expect it's going to be more in the way of social infrastructure. And my guess, Jason, is that Canada is gradually shifting towards a universal guaranteed income type of system. That's what Christian Friedland was kind of implying with her $37 billion package announcement the other day. You know, you only have to work 120 hours in order to qualify for half a year's unemployment insurance. So, you know, and I think that the point that we talked about today with Armand and myself, that it's not going to be a clear-cut end game. Getting rid of this virus. And so, you know, we have recovered to a certain level. We're above pre-COVID levels on some things with housing and retailing, but it's going to be bumpy going ahead until we actually do have a medical biological solution, which isn't that easy to get.
And how, regardless of whether he has bricks and mortar infrastructure or social infrastructure and universal income, through this 6 months, and perhaps who knows, how does he plan? How do you think he is going to be able to pay for any of it?
Well, he won't. There's not going to be any payment for it. It'll just be ramping up the debt and getting government debt even higher than ever before, certainly risking a downgrade of the Canadian currency. I guess that's one way to pay for it, is to devalue the currency and to devalue money. So that's always been the solution over the centuries, hasn't it? You just print more money to pay off the debt. And you devalue your currency and devalue the value of a dollar. A dollar isn't worth as much, so it means your debts aren't quite as heavy because those dollar debts that you have, they're not worth as much anyway. So.
It was interesting, your comment on boats and cottages. I was speaking with a friend of mine who's in the boat business, and he was explaining to me that they have sold more boats for next year than they have ever sold the following year, and you can't get them. Certain boat manufacturers, Boston Whaler being one, you can't get one. And so I think that sort of confirms your thoughts. I have one question, given your thoughts on vaccines and efficacy and anti-vaccine people. And if Armand's on the phone still, on the call, it would be interesting how you believe the vaccines are going to be rolled out, and will they be rolled out in the school system in Canada and the U.S.?
Well, you know, I live in the United States, and I am an American citizen. I'm also still a Canadian citizen. But I'm on Medicare, so I don't have any trouble getting flu shots here in Texas. I just show up, and what I'm going to do, Jason, I'm not going to line up in the drugstore to get my shots. I'm going to go through a drive-in. I'm going to get my flu shot at a drive-in, a drive-through. I'll roll down my window and keep my mask on, stick out my arm, and the paperwork will all be done in advance on the internet. And yeah, so I am going to be first in line to try and get a vaccine. I am not an anti-vaxxer. I am a boomer. I'm vulnerable. I wear a mask. I stay away from people on the sidewalk, and I want to get a vaccine as soon as possible. And what Armand was saying is that the availability of the vaccine is probably going to be, what can I say, more achievable here in the U.S. where I live, especially the fact that I'm going to let you in on a secret, Jason. I'm actually over 65, so there you go. I am over 65. Everybody knows that now, right? I've admitted to it. Yeah, so I'm just kind of hoping that being on Medicare, being a respected baby boomer, that I'll be able to get my shot as soon as possible. Canada, I think it's a different situation. I think there's going to be a lineup. It's going to take a while.
Yeah, so
Armand, are you there?
Yeah, I am. So I think that's absolutely right. That in the U.S. And congratulations for being in a high risk group.
Yes.
And
yes.
I think this
Thank
is one
you
of
very
those
much.
opportunities. This is one of those times where you actually want to be in that. You want to be tiered, and so I say this will be a tiered rollout in the U.S. And absolutely those at high risk and frontline workers, medical folks. I think the military. And I have to say all of those people that I just mentioned probably have decent insurance. I'm much more concerned about the Gen Y and the Gen Z folks, or Z as you have it in Canada. They the ones that have to go to work and work in the service industries and the grocery stores that are still open. They probably don't have good insurance. They will likely not get vaccines, and they're also the vast majority of those that are spreading the disease asymptomatically in the U.S. It's a real problem. It will be a problem. They will have to wait in line. As I alluded to before, I think in Canada, I think that once the vaccine gets there, you're in a much better position to capture most of those people in Canada because everybody has insurance for the most, almost everybody does. But the vast majority of people, where Canada is going to suffer is at the top, where they have to actually procure the vaccine for rollout. And I think that Canada is frankly way behind the U.S. in terms of being able to command the bully pulpit, if you will, on the world stage to get vaccine that's being manufactured in just a few places.
Well, getting back on that point, Armand, to Jason's question about the Trudeau government and its priorities, I think that we still have a very high priority on climate change in Ottawa. And to me, this is not the time to make climate change your top priority when I think the issue is the rolling out of and making available vaccines to Canadians.
Mm-hmm. I think it's a great example of trying to take too big a bite of the apple. Right now is the time to focus on the immediate problem, and it is an economic one. I have to say. The fact that the U.S. can wield a pretty big stick is going to put it towards the front of the line. And we saw this with other drugs as well. Canada tried, by way of example, to get a drug that I'm very, very familiar with, helping to develop it, called favipiravir, from the Japanese government, when the Japanese government said that they would provide it free to all countries for rollout. Canada was there almost first in line to ask for it, yet they still haven't received their allotment. They just don't command a presence with some of these countries that the U.S. or Germany does. unfortunately.
Armand, are you worried about the anti-vaxxers? You're not going to be one, are you? I'm sure you're going to get your...
I am going to get my vaccine as soon as it's available. If not, I might even start a lab in my garage and make one. I mean, I think...
I love that.
I am not an anti-vaxxer. The anti-vaxxers frighten me to death in the U.S. right now. I'm not as familiar with what it's like in Canada with respect to that, but the numbers that I've heard are exactly the same that we've just been talking about in terms of those folks that would not take a vaccine if it was free and widely available. It boggles my mind. I get that there are risks, but the ultimate risk here is death. Or if you want to think about it, maybe not death for you, since the mortality rates are quite low for most people. But what about your neighbor? What about your mother or father who are elderly and in an assisted living center? People who are immunocompromised. If you have a spouse who's undergoing cancer treatment, things that we don't traditionally think of. You can do all the right things, and I'm glad to hear you're wearing a mask in Texas, and I think that's fantastic. I wear a mask everywhere, and I've never really liked people, so that's okay. I think that's fine, but it only takes a moment, and it's probably not going to be your mistake that causes you to get sick. And so the anti-vaxxers frighten me to death.
Yes, I agree. Me too.
Okay, well, I think we've kept Peter and Armand a long time. I think it's been really beneficial. I think the medical background, the economic background, and the joint conversation has been great. So I'd like to thank them, and I have one parting comment for everybody on the other end of the call, is that when we first had the first webinar, we really talked about what programs were going to be available, how is the Trudeau government going to help us. It was then the next part was how do we apply and how much we could get. And I guess I have to deliver the bad news that we now have clients who are receiving 8-page letters from CRA asking them for all of the support for the money that they have been given. And I think it's a really arduous task to put it together. And I would just encourage everybody on the call that they actually seek professional advice before they start to send this information into the government and make sure they've got all their I's dotted and T's crossed. And they just sort of happen to start to arrive this week. And I think that's going to be a huge amount of work for everybody. And you just don't want to make a mistake. So on that note, I'd like to thank everybody. We will send out later today the tape recording of the seminar, and feel free to pass it on to any of your colleagues and friends. And if anybody has other questions that they would like answered, please send them to me, and I'll be happy to forward them to Armand and Peter. So thanks very much, and enjoy the rest of your day.
Thanks, Jason.
Great. Thanks, Jason. Thanks, Peter.